administering an oral medication to the patient, we need, of course, the medication cap, the medication card, the medication to be given, alcohol for disinfection, medication tray, and of course, a doctor's order to check if we are giving the right medication to the right patient. Good day. For this video, I will be showing you on how to administer oral medication to patient. First, you have to assess patient for any of the following. First is the contraindication to oral medication. So, let's go to the patient. Afternoon, Mrs. Chase. I am your nurse for this afternoon. I am Nurse Eileen. May I ask if you have any allergy for any medication? Thank you. How about allergy? Do you have any allergy to any medication, food? Thank you, ma'am. After asking the patient for their diet history and drug allergies, I will now be proceeding about the lab results of the patient to be considered before giving medication, as well as the knowledge of their health medication in order to identify or to know if they are able to adhere to their maintenance, if there is any, and also their fluid preferences if ever I am to give them oral medication. So, Mrs. Chase, based on your laboratory results, everything is normal and you're about to receive all the medications ordered to you. But may I just ask if you have any maintenance or any drugs that you are currently taking? Thank you. How about your fluid preference, or what would you like to drink if you are to take medication orally? Would you like water? Yes, you prefer water. Thank you. Assessing patient for those mentioned factors, I will now be proceeding with the second step, which is to check record accuracy and completeness with the prescribing physician's written medication order. So, after checking the order, we will now be proceeding with the hand washing. This is to reduce the transmission of microorganisms. After washing the hands, let's now proceed with the arrangement of medication cups and tray in the preparation area. So, also we'll be preparing the medication individually according to time. As you can see, there is the bed number, which is to be given at 8 a.m., bed 22 at to be given at 8 a.m. also, and bed 23 at to be given at 8 a.m. also, as well as this one, also for bed 22 at the same time as 8 a.m. So, we'll now be going to the patient. Okay, when preparing capsule or tablets with floor stock bottle, you prepare it this way. So, when you say medication with floor stock bottle, it's one bottle of medication where capsules, several capsules are placed inside. So, when you prepare this one, you pour the windows to be given to patient this way to avoid touching the capsules inside, and as well the capsules to be given to the patient. Then you put it on the medication cap to be brought to the patient. Simultaneously put a tablet or capsule to be given to patient in one medication cup. Like for example, this one, same patient, Jose de la Cruz, but two medication. So you put them together in one cup because the medication will be given at the same time at 8 a.m. So you have here two medication that will be prepared. Continuation of the preparation of the oral medication. In case that your patient has difficulty swallowing, we may use a pill crushing device to help client swallow the medication. Or if there is none, we can use two medication cup here, and we'll be able to pulverize the medication. If not tablet, we may use capsule. We can get what's inside here. So you see there, it's already pulverized. Then we'll be adding few drops of water to it, or the preferred liquid for the patient, or soft food to accompany this medication. Still in preparation for the oral medication, this time we'll be focusing on the liquid preparation of medication. This time we make sure that what medication is written on the box should also be the one inside, or what is written on the bottle. And you start this by opening the bottle. Then you make sure that the cup is placed upside down to avoid contamination of what is inside. Then you get the medication cup, which has calibration. There is the calibration. If it is to be given to patient at 5 ml, then at eye level, you may measure the medication. Then, you take note that you do not soil the name of the medication to avoid its destruction or erasure, so that the next nurse will know what medication is in this bottle, and you carefully put it in the box as well, carefully avoiding destroying the name of the box as well.